Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We're joined today by Dr. Jolene Brighten, a naturopathic physician, best-selling author, and leading expert in women's health. Welcome.
Hi, thanks so much for having me.
Absolutely. Now, you are widely recognized as an expert in post-birth control syndrome, a condition that is unfamiliar to many. Can you explain what that is?
Yeah, so post-birth control syndrome is a collection of signs and symptoms that tend to arise about 4 to 6 months after discontinuing hormonal birth control, whether it's the pill, the patch, the IUD, or the NuvaRing. And for Depo-Provera in particular, it has to be after the Depo shot has worn off. And so this is what we see as what some women have described as the fallout after birth control, where these symptoms can show up in any system of the body. Sometimes they're a return of symptoms that women previously had, or maybe they were using birth control for, and oftentimes it's the onset of new symptoms associated with the use of birth control.
And so can you talk about what some of those symptoms are typically?
So symptoms can range from neurological, like new onset of migraines, brain fog, maybe having anxiety or depression. We can also see digestive symptoms arise. So some women may be diagnosed with IBS because now they're experiencing constipation or diarrhea. And then we can certainly see reproductive issues. So loss of menstruation, what's known as post-pill amenorrhea. And we can also see frequency of menstruation increase. So women are bleeding more often than they should be in a typical cycle. And for some women, we also see other hormonal issues start to arise. So insulin resistance, acne as a few examples.
Now, you're speaking to this from personal experience. I was reading on your website, right?
Yeah, so I was a 10-year pill user, a first-generation college student, and so I have a lot of gratitude for having access to hormonal birth control. Only once I came off, I experienced a loss of menstruation, so I was diagnosed with amenorrhea, and I also developed cystic acne, two symptoms that had never been present before in my life. And when I went to my doctor, what he actually said to me is that I likely had PCOS, polycystic ovarian syndrome, all along, and that I just didn't know it. And to me, that just wasn't right at all, because I knew I had clockwork, predictable periods through my youth until I was put on birth control. And I had clear skin. I didn't have any issues with acne before beginning birth control. And so through that, I had to lean on my background as a nutritional biochemist, start to integrate what I was learning in naturopathic medical school, and I was able to reclaim my period, clear my skin, and I went on to have a healthy pregnancy.
Yes. So that, I would imagine, having that personal experience helps you relate to your patients a lot better, right?
Absolutely. And you know, the thing about post-birth control syndrome is that when I went through it, I thought there was something wrong with me. I actually didn't want to talk about it. I thought I was the only one who had ever experienced this. And once I got into clinical practice, I started to see that many, if not all of women, struggle in some way to break up with birth control after they've been on it for a period of time. And I actually got the reputation as being the doctor who believed women's birth control stories, which I'm trying not to giggle, but I still kind of giggle about it, that it was such a bizarre thing that women would call my office and say, I heard you believe women's birth control stories. And this was really born out of the fact that they would, for example, get an IUD placed, have new onset of anxiety, and their doctor would say to them, it's not your IUD, it's you. Or they would come off of birth control and they're saying, for the first time in my life, I'm having these symptoms, and their doctor would say, well, you probably should just get back on birth control. And that's something that I've done very differently in my clinical practice, is that while I love scientific research and I love diving into the research, the lack of research to me doesn't mean I don't believe my patients.
Right. Let's talk a little bit about your practice. Tell us about it.
Yeah, so I have a women's health practice, and so my focus is on women's endocrine issues. So things like, heavy periods, irregular periods, Hashimoto's thyroiditis. That's a very common condition that I treat in my practice. And then, of course, I get a lot of women who are coming to me wanting to transition off of birth control or who've been struggling ever since breaking up with birth control without being able to get answers about what's going on.
Mm-hmm. And generally, I know not specifically, but generally, what is your approach?
So my approach is holistic. Like most naturopathic physicians, I'm looking at each system in the body and how they integrate together. So, it can serve in some regards to compartmentalize the body and view a system singularly. What I often find is that a lot of women's issues are rooted in gut health, liver detoxification, and overall detoxification issues. And then, of course, diet, stress, and lifestyle. And since I began my career first in chemistry, then subsequently nutrition, and became a nutritional biochemist, I'm very much interested in how we can utilize nutrients and really food as medicine to modulate the system, to bring things back into balance, and to really provide women what they need in order to have optimal hormones.
So do you start that with micronutrient testing, or how do you know where you're going with that?
Mm-hmm. So with every patient, we have a comprehensive intake form, and I always joke with my patients, I'm going to ask you more questions than anyone ever has, and they will attest to that. So it first starts with the patient's own data, what they're walking around, what they're experiencing. Every patient in my practice is handed a journal because I'm dependent on their data of their body and how they experience life in order to interpret labs. So I always view labs through the lens of the patient's experience. So in my practice, when women come in, we'll start with the intake, we'll do a physical exam, and then I'll come up with a treatment plan that day. That treatment plan is often about testing what is true for them. So we may start with an elimination diet or something along those lines, bringing in nutrients in terms of supplements to really help support them where they're at. I'm a big fan of symptom management while we address the root cause. It's something that if you're struggling with estrogen dominance and having severe PMS symptoms, for me to say, let's change your diet, we're gonna work on the root cause, you'll feel better in 3 to 6 months, women don't have time for that. And
right.
Quite honestly, I think they would storm out, at least I would. So we very much about how do we get symptom relief. So for example, if they're having anxiety, we start looking to sleep, how to get better sleep, doing stress reduction practices, deep breathing, binaural beats, bringing those in, and then leveraging things like, perhaps on the spectrum it might be passion flower, or we might be leveraging GABA or L-theanine to get that symptom management while we investigate deeper. So I always start with comprehensive blood work. So looking at things like a CBC, comp metabolic panel, looking for markers of inflammation, cardiovascular disease. And then for every woman in my practice, we do a full thyroid panel along with antibodies. Since Hashimoto's is so very common and it really likes to affect women most, we want to make sure that we're ruling that out. So we'll look at the basic blood work like you would find in most practices, and then based on what that patient is presenting with, we may be doing additional hormone testing, like perhaps using a Dutch test, because that's going to reveal metabolites, and then of course evaluating gut health. So that might look like doing a stool culture, or we might be doing a lactulose breath test if there's potential for small intestinal bacterial overgrowth. So it's very individualized based on where the patient is at, what I think is going to provide us the most answers to really move the needle towards their health goals.
And the hormone replacement is bioidentical, of course, right?
Yeah, so if we're going to use hormone replacement therapy, we tend to go with bioidentical. Now, when it comes to thyroid hormones, it's all about what works for the patient. So, some patients will come in saying, I want natural desiccated thyroid hormone. Sometimes it doesn't work for them. They actually do better on a synthetic T4, synthetic T4-T3 combo. So again, to me, it's all about what works for the person sitting across from me, regardless about, what it is that they thought they might want or what I thought might work best. It's all about what is true for them. And I do have patients who elect to stay on hormonal birth control. Of course, those are synthetic hormones, and we support them through that journey as well.
You have on your website that one of your passions is helping women understand their bodies.
Mm-hmm.
And I would imagine that takes time over time. these are not 7 to 10 minute office visits, are they?
No, my office visits are definitely not 7 to 10 minutes. But what we do to help provide further education is we put out lots of free information on drbrighten.com. I have a YouTube channel. We also have Instagram. We do live Q&As there. And so we have a lot of channels that really are aimed at supporting women globally to understand their bodies better. And this also serves my patients as well. And so within their treatment plan, I'll say, you know, for example, we just diagnosed you with a condition, and here are several articles I've written about this. Here's a video where I go on to explain more. That way they can really investigate for themselves, feel empowered in taking charge of their health, and then be more educated when they come back to the next visit with me. And in that way, it actually makes my job so much easier. And all of this was really born out of an epiphany that I had, that I actually didn't understand how my body worked or my menstrual cycle until I was in medical school. And I remember sitting there in class thinking, you shouldn't have to go to medical school to understand the body you live in. And so since then, I've really been on a mission to dispel the myth that hormones are just too complicated, so why even worry about them, or that, you know, hormones are, you know, just making women emotional and working against us, and really rewrite that story in women's health, which is to say that your hormones actually give you superpowers. And there's a way you can understand your body and work with your cyclical nature to be more productive, to be a better mother, or to achieve whatever the goal it is that you desire.
Mm-hmm. So today we're here at the annual AFRM conference in Las Vegas, what they call their World Congress. When did you first get introduced to AFRM?
Oh, I was introduced to A4M years ago. So they have one of the best hormone modules. Whenever people ask me, you know, if I want to go deeper on hormones, or I want to do continuing ed, where should I go? A4M is what I recommend, because I think they've done a really good job on staying up to date, especially with the bioidentical hormone research, where you see a lot of doctors really parroting research that's outdated, whereas A4M brings the most cutting edge research to the forefront, so that clinicians who don't have time to sit on PubMed for hours or every weekend, which sometimes I do, can actually get access to this information and be able to stay up to date and serve their patients in a better way.
Mm-hmm. While you are an established clinical expert, you have also demonstrated that you are an ever-curious, lifelong learner. What are you most curious about clinically in this stage of your career?
At this stage of my career, I am very curious about the long-term neurological outcomes of using hormonal birth control. So we've never had a long-term study to show us what long-term menstrual suppression via hormonal birth control does to the female brain. And I'm also very curious about the hormone-immune interaction throughout the body, but also what is happening within the neurological system. As we've come to understand, women are disproportionately affected by Alzheimer's and dementia. So as that population grows, we're seeing more and more women getting this diagnosis. So since I'm very invested in preventative medicine, not only for my patients, but for myself, this is an area I'm very interested in exploring, as well as the concept of how is it that our hormones are impacted by stress, and how do we actually take the life stressors and leverage our hormones to be able to move through those with grace?
Mm-hmm. That sounds like a fascinating study.
Yeah.
Well, thank you so much for sharing your time with us today. We really enjoyed it.
Yeah, thank you so much for having me.